It is a video demonstrating the clinical palpation for the shin area. The shin area refers to the area below the knee joint and above the ankle joint. From the proximal part to start with first, every time we have the clinical hypothesis in our mind before we do the palpation, then what possible clinical hypothesis can happen in the shin region? Then we can have shin splint and the ankle extensor and ankle muscle overuse. Before the shin splint, this condition is very uncommon, but it happens. In my more than 10 years experience, it happened about 3 to 5 times. It's the common peroneal nerve strain associated with sprained ankle because of excessive inversion force and the strong tension here. Not only injury the soft tissue, but also the common peroneal nerve. How to find the common peroneal nerve? You find the superior fibular head, okay, and the junction with the tibia is the junction, and slightly below, then is the point of common peroneal nerve. Then you find on this, then you normal sensitivity you compare with the other side. Some people after sprained ankle and have the drop foot, or they complain of discomfort, pulling, numbness, discomfort here, then you can check with the common peroneal nerve. Of course, beside the nerve itself, it is possible to have the joint sprain on the superior tibiofibular joint as well. So after the people running, other exercise, they always feel discomfort on this area. Then if they have the history of sprained ankle, then we can find the laxity here. The management is also important to have initial immobilization covering the superior tibiofibular joint. We can find the head here. The shin splint is a common term, okay? It can be the compartment syndrome. Anterior, posterior, or medial, yeah, you can see the tenderness around the soft tissue. Remember, don't miss the light touch sensation test because it will have the impaired sensation of the tissue there. Then they can feel very slight decrease in sensation. It's a possible sign that you can look for. Then for lower of the tibial bone, when I manage other army officer or some gymnasts, they have repetitive jumping, especially before the competition, they have intensive training, then they can have localized tenderness on the shin bone. Not up to the extent a stress fracture, but if you find a particular 1-2 part, then it's more sensitive, more uncomfortable compared with the other side, and they complain the shin pain. You need to bear in mind that already excessive loading. If they have a lot of marching, jumping activity, then you need to ask them to do some offloading adjustment. Okay. Coming to the muscle, although not often overused, then the tibialis anterior muscle is a very meaty part on the lateral side. Then sometimes some runners or other people sprained ankle also have some tenderness, the muscle tenderness here, the muscle cramp together. We can do some soft tissue release. Then first of all, you need to find any comparable tenderness here. Comparatively, same thing to the peroneal muscle, especially some common overuse will overuse the ankle inverter. Then there's a trigger point you can find in the middle side, about 1/3 of this region. You can find a trigger point here. Okay, then you can see any tenderness here and check the ankle inversion, muscle strain or pain. Going down to the distal part, beside the ankle we have gone through, there's some possible tendon overuse such as hallucis extensor. Then they have some localized pain because of the repetitively dorsiflexion and entrapment here. Then you can find around the joint line. Then on middle side is the major tendon of the hallucis extensor. You can find in this area any localized tenderness and soreness. Okay. And then go to the lateral side. This is the high ankle sprain. If this is not ATF at all, it can be the sprain of the inferior tibiofibular joint here. Okay, so you can find the tenderness right in front, not below the fibular head, the tenderness, and sometimes you can see some swelling here. Okay, so and also there's another common condition is that the tibialis posterior overuse, then people, the tendon, they have strong tension, then complain of the middle foot pain. Of course, we need to do the differentiation for other similar conditions, just a navicular cuneiform sprain. But if you suspect the tendon high tension overstrain causing pain here, trace back to about 1/2 and slightly below. Then here is the muscle belly, the trigger point refer to the tibialis posterior muscle. Then you can see any tenderness here. This is the clinical palpation of the shin area.